I thought. Hello, everybody. Let us know if you can hear us. I'm gonna. Hello, hello.
Good morning.
Okay. And hello, how are y'all? How is everyone today? We are back. It's 10:30 with Melissa Gibbens, and I had to ask her exactly because she has such a wonderful practice. I had to have the exact terminology to use. And she is a nurse. She's going to tell you more about her business, and she focuses on non-surgical cosmetic procedures. And we've got her here to talk to us, to answer questions about skin and any other questions you may have for her. So the first thing I'd like to do is welcome Melissa. Thank you so much for being here.
Good morning. Thank you for having me.
I am super duper excited. Now, can you just tell everyone a little bit about you and what you do and explain more about everything?
So yes, my name is Melissa Gibbens, and we have a cosmetic non-surgical practice. We are under the direction of Dr. Bert Ferguson, and we are located in the Memorial area in Houston. And we do all non-surgical cosmetic procedures, everything from Botox fillers, chemical peels, hydrofacials, cool sculpting, Kybella, Agnes, Scarlet. We do a multitude of things, ranging from the least invasive things non-surgically all the way down to some of the little bit more of the invasive procedures. Everything that we do in our practice is FDA approved and safe. And so, we've been in private practice for 7 years, and I've been in the industry for 20 years.
Awesome. Wow, 20 years. Oh my gosh, I've been doing makeup for 17, and it just seems like forever. So tell us about your passion and what brought you, when did you decide to pursue this career, and what was your passion?
Well, I always say I've kind of grown up in this business. I originally started out working for a company that it's under the SkinScriptions umbrella, but at the time it was called Biomedic. And so with that company, I taught chemical peels and skin rejuvenation, and I traveled all over the state of Texas. And then I was there for a few years, and then that got recruited by a medical device company to come and do some training for them and be a sales representative for them as well. And they are now MERS Aesthetics. And so I was there for quite a few years, and I had some really good mentors in the field that, encouraged me to go back to school for yet another degree. And so here I am now in private practice. And so I've just kind of grown up in this business. I don't really know how to do anything else. So here we are.
Well, it seems to suit you well. You've created a little empire for yourself. That's awesome.
We love it. We have a team of 5 people, and we're super busy every day, or we were until all the pandemic with the coronavirus started. And we miss our patients, I must say. As busy as we are, we see a lot of patients every day, and we miss them. We're ready to see them again.
So do you have, when we talked the other day, did you have some ideas of some things that you wanted to share with people? Right now we're all at home and we have extra time, and some of us would like to utilize that time to just really pamper ourselves. Did you have any thoughts that you wanted to share before I got to the questions?
I will just say what I've been doing, and I think for my team as well. So, a lot of time we don't do things because we can't have social downtime. And it's because we're at the baseball field or at the soccer field or we're at the football field and so this is a really good time to do those types of things at home. We call them those skin prep type things with using retinols or retin-A's or your hydroquinones, some exfoliants, things like that to just when we can have a little peeling and a little bit of redness and a little bit of downtime, this is the perfect time to do it, especially before we go into the more sun aggressive months in the summer where we kind of tend to back off of some of those things. This is just like the last time of the year that we do those things. So what we're telling patients now is exactly what we're doing. We're doing little light chemical peel kits at our homes that you can purchase on our website or on our Instagram. We are doing I'm using my retin-A right now. I've been super peely the past couple of weeks. It kind of feels good, because it's like, I don't have anywhere to be and I'm not going to be in the sun. So right now, just to get the skin prepped and to do the things that we never do for ourselves, because we always have something going on lifestyle wise that we feel like we can't be peeling or red or irritated. This is the time to pull out those glycolic acids or those retinols and things like that and get your skin, give your skin a workout while you're at home during this time.
So if they, and this is not about, trying to sell things, but say someone wants to get products like that, say they wanted to go to Amazon and find a glycolic peel. Are you hearing me okay?
I am.
Okay, good. I just wanted to check. And say they said, oh, well, you can get that for a lower price on Amazon. What do you feel about that? I mean, I know some of the salespeople may be reputable, but I know the quality and the expirations and the things that are necessary.
Well, I always say if the deal is too good to be true, it probably is. And I will tell you that most of the what we call cosmeceuticals or things that are sold in medical offices and things like that are not authorized distributors online. And so it's funny because even the representatives will bring in the knockoff product and then the real product, and it's really hard to distinguish the difference between the two. So these are either products that are they're replicas, quite frankly, and they look the same, but they're not the same. And so, buyer be conscientious. I don't like to say buyer beware, because some things that are sold, if they're sold in stores and things like that, they're absolutely the same that they would be. But if they're more aggressive products that are under the direction of a physician or a medical spa, these things are not sold typically online. So, I would say, you want to get a good deal or Groupon something, but you don't necessarily want to Groupon your face. So we have some really nice deals. A lot of places are, if we're not your med spa of choice, but a lot of your offices will work with you right now on pricing, giving discounts. Last week we did 25% off some products, 50% off some products. So just know that if the price is much cheaper than you would pay, it's probably not what you think it is. And a lot of times they're expired products as well. So just be conscientious when you're purchasing.
Right. Well, and do they need do you need an official prescription for like a retin-A or the more aggressive peels or things like that?
That's a good question. There's some things that you do absolutely need a prescription for. Retin-A and hydroquinone, which is for lightening brown spots, is one of those that you do need a prescription for. But the other products like the glycolic, there's different glycolics and alpha beta hydroxy acids and things like that. You don't necessarily need a prescription for, so you can get those in the marketplace. Just the more aggressive products are going to be the ones that we dispense here. But like, for example, one of the chemical peel kits that we sell in our office that's an at-home kit is by a company called Glow, and Glow is not something that is super, super aggressive, and you don't necessarily need a prescription for those types of products.
Okay, so if someone went to your website, and I'm thinking about the people who are watching us now, and they're in California.
Right.
If they went to your website and wanted to purchase something and it needed a prescription, could you do like a virtual consult?
So our nurse practitioner can absolutely do a virtual consult. We could set that up with people one-off. So if they want to DMS or PMS, we can absolutely do those types of things, as long as we have our nurse practitioner, make sure that that's the right thing for them and do a virtual consultation that way. But there, like I said, there's many things that you can use at home that you don't need a prescription at all. And if there's anyone that's confused by, well, what do I use on my skin? We get that question a lot. Like, how many steps am I supposed to do? How aggressive does it need to be? We're happy to discuss those things because it depends on your skin and your skin type and how tolerant you are to things. I'm super reactive. And so I have to back way off on things. I cannot really even use it as it describes on the box. So I feel like, everyone's so personal. You have to just really get personal and do what really is going to work for that particular patient, because we know one size does not fit all.
Well, and that was one of the questions that was in the group. Let me go back here and look at it. It was, how do I know what products are right for me? Or how do people know that when a product's not working for them or it's a wrong product? So yeah.
So, well, that's a very good question. So it depends on what the goals for the patient are. If the patient is looking for something to lighten brown spots, there's going to be certain recommendations. If a person's looking for, to make their pores smaller, there's going to be different types of products. If someone wants something anti-aging, then we would recommend different products. So there's many different products in our, armamentarium that we use. It just depends on really specifically what the patient's looking to do. And so we can really personalize that. We can give some general overviews on things online just by, this is going to be anti-aging. This is going to be for exfoliation. This is going to be for collagen building. So specific to the needs or the wants of the patient, we can customize it. And then we do have those products that doesn't matter whether you're oily or dry or what you're trying to do. Those collagen boosting products are really kind of what's right for everyone. And also antioxidant protection is really something that is important for everyone.
That's a question I had for you, actually, when you say antioxidants. So I follow some cosmetic chemists. I listen to their podcasts and what have you. And one of the questions I have had, in fact, I even submitted it to them and they haven't answered it yet, but I have heard that antioxidant products actually can help reverse some of the damage. Is that true?
That's absolutely true. So your L-ascorbic acid products or vitamin C products are really going to help, free radicals. They're going to protect your skin from free radicals and UVA and UVB damage. And also they're going to help lighten some of those brown spots that people don't like. It's not the most aggressive way to treat, but it absolutely is a way to help kind of reverse some of the signs of aging and furthermore, protect you from more aging and future damage. So it's even sitting in front of your computer, people don't realize you're being exposed to, UVB rays and things like that. So, and there's just many different ways that we can protect our skin with antioxidants, and they do help reverse some of those signs of aging. Absolutely.
And I just heard, I guess about a year ago, about a product on the market, and I don't have a name, but it actually, and I'm sure there's plenty of them out there, but it actually was developed to help combat they call it blue light, I guess, from the computers or what have you. What's that about?
So, some of those products, I really feel like if you're wearing just any sort of sun protection, UVA, UVB protection, there are products that are specific to that blue light exposure and things like that. And then your antioxidant protection is also going to be helpful in those situations. But yes, there are studies now that are saying that you are getting those free radicals, even from looking at your computer, which we know is true. And so it's important that you just protect yourself, even if you're in your own home, you're still getting exposure to those types of rays. So it isn't in that exposure. So it is important to protect yourself even when you're inside, which sounds crazy, but it's true.
Well, and that was another question about do I really need to wear sunscreen, and do I need to wear it 24/7? And, so yeah, that was another question. Let's see what else we have. Dark circles.
Yes.
Can you tell us what that's about and how we work with them?
So, dark circles are hereditary. Mom or dad has them. If you have them, I always say in our office, a lot of times we will do some fillers just right under the eye area to help bring that tissue forward. And it really helps the appearance of those dark circles. I would be lying to you if I told you that was going to get rid of them. One thing that's pretty effective with dealing with dark circles is just if we use a product like our anything that's going to have stem cells to help, collagen stimulate in those areas that the tissue is super, super thin and fine, that tends to help. And also fillers in the practice tend to help as well. But there really isn't, a magic cure for dark circles per se. So I don't want to mislead anyone and say, oh, sure, we can totally get rid of dark circles, but there are things that you can do to help them look and appear to be less. Yes.
And with the topical cream, or do you need to really come in and see someone that like you?
So, there are some claims for different eye creams that really are going to help with dark circles. We find that we can really help more puffiness using eye creams and skin elasticity and things like that. So the elastosis and the puffiness, we know that things like caffeine are going to help. And those are in some of the eye creams that we carry in some of the products. But as far as, getting rid of the dark circles, that's not something that is going to be found in a jar, unfortunately.
Well, it's good to know, because there are a lot of products out there that are targeting that
things, yeah.
audience. Well, what about exfoliating? I'm going down the list right now,
Okay,
by the way.
perfect.
What about exfoliating? How often should I exfoliate? What, and I know it's going to be dependent. Oh, maybe we should talk about the difference between a chemical exfoliation and a physical exfoliation.
Right. So it depends. First of all, the first question that you asked was, how often should I exfoliate? And that really depends on how tolerant your skin is. If someone is not used to using a glycolic acid and then they're going to start, I wouldn't have them start using it like the directions say every night, before bed, after washing their face, because it's going to make them irritated. So our approach is typically that we titrate people up. And so if you're going to use an exfoliant, a chemical exfoliant, so something like an alpha or beta hydroxy acid, those are things that you're going to want to titrate your tissue up and get your skin used to using. The physical exfoliators are going to be things like scrubs. People love scrubs, washes that have those little granule beads in it and things like that. Those tend to be something that you can use a little bit more often, and depending on what type of product it is. We carry products that you can use once or twice a week. There are some that you can use once a day, depending on how oily you are or how dry you are. So it's really going to depend on how tolerant your skin is to those things, and if your skin has been exposed to any of those types of things. So to kind of divide those into two categories, your chemical exfoliants are going to be your alpha hydroxy acids, beta hydroxy acid, glycolic acids, lactic acids, things of that nature. Those are going to be your exfoliants. Even like retinol, that's considered an exfoliant, because it helps exfoliate those top layers of skin off faster than you can do on your 28-day turnover. And so then your exfoliants that are going to be your more mechanical exfoliants are going to be scrubs and things of that nature that you're actually, you feel those little granules, and that's actually going to physically exfoliate that tissue. Right.
Oh, you said something, the 28-day turnover. I think that's something that a lot of people, they didn't study skin. They didn't study the whole process of the birth of a cell to the shedding of the cell.
Right.
And then that changes depending on your age too, correct?
Yes. So the reason that we encourage exfoliants is because the cell cycle of the skin, or the skin cell, is 28 days typically. But we know that as we age, those cells sometimes turn over a little bit slower and not as effectively. And so the reason that we exfoliate is to get those top dead layers of skin off, so we have the newer, fresh skin underneath. So it's important to keep the skin exfoliated, because a lot of times if we're not exfoliating and we're spending a lot of money on things like growth factors, those products really aren't even being able to penetrate to their full potential, because they're not being able to get in, because there's all those layers of skin that need to be exfoliated off in order to maximize the penetration of some of those more expensive products, like our growth factors that we're using and our antioxidant protection. So it's nice to get exfoliate and get those cells off, so we can see the prettier skin, but also the healthier skin. And it's dual faceted, because then it allows our products that we're using to actually penetrate more.
I was just going to ask that. Okay, so the next question is about pores.
Yes.
I want skin like yours. I want just poreless skin. Is that even possible for someone who has large pores? Can that actually be corrected?
There are tons of things that you can do for pore size. At home, using your exfoliants is going to help. Also, using growth factors. We really, really believe in growth factors in our practice. They're collagen boosters. They tighten things up. And so a lot of times patients come in and they say, I didn't even have pores problem until I was in my 40s. Well, we've always had pores, but when we get more elasticity, we start to see those pores. And so we've always had them. So it's important that, we can do things at home like exfoliate and use growth factors at home to minimize those pores. And then our retin-A and retinol products obviously help with that process as well. And then in the office, we can minimize pores from doing chemical peels. We can do Scarlet, which is microneedling with radio frequency, which is super effective for pore size. I've had so many people text me and say, oh my God, if I could just come in, I'm missing my this, or this. But yes, there's absolutely a way that you can achieve more flawless skin. Absolutely. And people
Wow.
sometimes say, is it too late? And I'll say no. I mean, we have patients in their 70s and 80s that absolutely have stunning integrity to their skin and look, brilliant. And I'll say this, for a long time, all we did was exfoliate. I mean, retin-A has been around for years. And so we thought, the thinner the skin, the closer to God. And that's not true. We now know that it's not only important to exfoliate to achieve those results, but it's also important to feed the skin and to nourish and cause collagenesis in that skin. And so I always tell people, anything that we can do for collagen induction therapy, we have to heal and feed the skin and not just scrape off layers and scrape off layers and scrape off layers. So the market's kind of shifted. So not only is exfoliating important, but also feeding that skin is super important as well.
And that's where we go back. The antioxidants are feeding it. And what about, oh, this wasn't a question in the list.
Yes.
What about hyaluronic acid and hydroquinone and squalane? And those are all the same family, right?
No, hydroquinone is not in the same family. Okay. Hydroquinone is a melanocyte inhibitor. So hydroquinone is going to help bleach out the dark spots that are on the top layers of the skin. Your squalene, and your squalene's a little bit different actually too than hyaluronic acid. Hyaluronic acid, your body produces, your skin has hyaluronic acid in it. And so when you put topical hyaluronic acid on, it plumps up those cells. So, hyaluronic acid also makes your body and your skin's ability to hold more water available. So typically hyaluronic acid products hold their weight 1,000 times in water. And so all we're doing is encouraging that cell to hold water and be more plump. And squalene is going to be more of a topical ointment type product. So that's going to be more of a moisturizing product. And your hyaluronic acids are going to help hydrate the skin by helping them hold water. And then your hydroquinone is a skin bleach.
And I knew that. There's another ingredient though that that's in addition to the hyaluronic acid and the squalene or squalene.
We don't use really many products that product in there. So I think it's squalene.
Okay, but it seems like I heard of another one. But you did bring up a good point, and this is something that I get a lot, and that is, what's the difference from a medical perspective? What's the difference between hydrating and moisturizing?
So this is a really good question. Some of our acne patients are very confused when we offer them a hydrator, and they're like, I don't need moisture. I'm super, super dry. I'm super, super oily. And so we tell them there is a difference. If you're going to hydrate the skin, even oily skin needs to be hydrated, because if you don't have any hydration to that skin, the body will sometimes produce even more oil. So it's important to know the difference. So you want something that's going to hydrate the skin. It's going to help skin that even is oily needs to produce and hold more water. And so that's going to be different than someone that's dry, like myself. I'm super dry. And so I'm going to need products that are more moisturizing. So those types of agents are going to be a little bit more emollient and use some more of those things that are going to be helpful for the dryness and not just hydrating the skin, if that makes sense. Does that make sense? Okay.
It does to me.
Okay.
But sometimes I have a difficult time trying to explain things where people can understand, because I'm not a doctor. I've only been to more of an aesthetics, something not as advanced as you. There was another question when you were talking. I was like, I got to ask that one. Okay, let me go back to the list and see how can I avoid wrinkles?
Well, good luck if I knew the question to that. No, they're just keeping the skin healthy. There's this big misnomer that when you're in your 20s and 30s, you really don't have to do anything for your skin. And then you all of a sudden have to start caring about your skin later on in life. And so first of all, you want to do preventative things to help the integrity of the skin, even things like Botox. I mean, people go, well, I'm supposed to come in and do that or wait till I get wrinkles. So there's a big, part of the market that goes, this is a preventative type thing. So anytime we can keep those static wrinkles for getting in the skin where we have to take those away or try to get rid of those, it's super important. So you can keep from getting wrinkles by doing those things, like little tiny things, like little tiny treatments of Botox, or when I say Botox, that's like saying Kleenex, but there's many different neurotoxins available. So, doing those types of things in the office will help. Any type of those collagen induction therapies are going to help. So, gosh, we have many in our office, but if you wanted just to think about things you do at home, some products that have they're called growth factors, and we prefer human growth factors in our practice. There's plant growth factors and human growth factors, and we could go on and on about that in a totally different day. But what the growth factors are going to do is they're going to encourage that tissue and that skin to turn over faster and healthier than they were before. And so those products absolutely help, hold the phone per se, and keep patients from going down that conveyor belt of aging. We're just trying to keep them pulled back a little bit in a reasonable fashion.
And are the growth factor products typically pretty pricey?
It depends. They are a little bit more pricey than your drugstore products. And the reason that they are is because they work. The products in our office, that people don't love them, I mean, maybe they can bring them back. And I will tell you, the companies really stand behind the science. We are so picky with our products that we carry in our office. And I will tell you that we have the best. I mean, I'm convinced by it because we have the opportunity to use anything on the market. So growth factors are more pricey than, let's say, a vitamin C, but even some of the growth factors have vitamin C, A, E in them. So it's like in one product may do multifaceted things. So then you're eliminating 4 or 5 steps. And if you look at the value of that compared to using, an antioxidant and then this, and you have just one bottle with everything you need in it, it's actually a little bit less expensive than having like 6 or 7 steps, because I'm a busy mother of 2. I'm in school, working on my master's. I run a practice where we see many patients every day. I don't want something that's super confusing in 8 steps. I want 1, 2, or 3 steps, and then I want to be done with it. And so I think keeping it reasonable with patients and showing them that value, that if you use it appropriately, you're not going to have to do 15 steps. It's actually a little bit less expensive than having a drawer full of products and every single one having a purpose.
Mm-hmm. So you brought up another question.
Okay.
I gave you this whole list, and I'm coming up with questions that weren't on the list, but things that I hear these questions, when I'm just doing people's makeup. Toners, tell me, are they important? Do they, or, because I've heard that it's controversial now. It used to be it's
controversial. I would say if you're not throwing the skin out of pH, you absolutely do not need a toner. You do not have to, pH balance the skin. If you're using a wash that actually does its job, then you can just toss that out the window. So I don't use a toner. I have never used a toner. And I'm in my 40s. I'm not gonna give away my exact age, but I've never used a toner because you don't need them. You just don't need them. And now if some ladies want to use one, it's not going to really hurt the skin. I would just, I would not use something like witch hazel, or people use all these kind of aggressive exfoliants that over dry the skin and things like that, but they're absolutely not necessary.
I use them, but it's only habit. It's what
habit.
When I first started taking care of my skin, and that's all I do it. But I also am one of those people that the more products you give me, the happier I am. It feels like I'm pampering myself. So, everybody has their own preference, I suppose.
Absolutely. And that's important too. When we're talking to patients, we ask them, if they come in and they say, I like, my steps, then we can absolutely do that. But, for someone like myself, I don't like all the steps. I just want something simple and effective.
Yep.
So,
yeah. What about hands? That's a question.
Oh my goodness. Well, we forget about our hands. And so our necks and our hands are absolutely the things that tend to show our age the most. Mm-hmm. And it's little things. So your hands deserve the vitamin C that your face does. They also deserve, you know, the growth factors that your face does. They deserve the vitamin C's that your face do. And they also deserve the sunscreen, because we're driving, we're doing things, we're constantly exposing our hands. So, you know, just use the products on your face that you're using on your neck too, and use them on your hands, because they absolutely make a difference. Now, if you're wanting something a little bit more aggressive, we can, you know, get off the brown spots with our lasers. We can use fillers in the hands if someone has really the tendon show or they don't like the vein show. Those are more aggressive things that we could do in our practice. But just exfoliating your hands and putting on your products at home right now until you can come in to see us will absolutely make a difference. And, you know, if you don't believe me, treat one hand for 28 days and don't treat the other hand, and compare notes.
I think that's a challenge we should start.
Yep.
It's the hand care challenge.
Absolutely. I love it.
Let me see, what else do we have? Okay, here's one. Oh, I've got a cut. Oh, yeah. What's the most important part, in your professional opinion, of a skincare routine?
Okay, explain to me what you mean by that.
Step. What's the most important step in a skincare routine? Do you have, is there one, or steps? Let's say plural.
Okay, well, I would, in my, what I think is most important for my skin is using a growth factor. I might skip a lot of other steps, but I'm going to use my growth factor, and I'm going to wash my face. Even if I wash it with, we have some cleansing wipes, even if I'm being super lazy, and I cannot believe I'm even going to say this on Facebook Live. Some nights when I've studied late and I just do not feel like washing my face, we have little pre-moistened towelettes by a company called Obagi, and I will at least wipe my face off with one of those, and I will make sure that I put my growth factor on. So that is when I'm being super lazy. God forgive me for saying that. I know the reps are going to be blowing up my phone in a second. So what are you saying? But no. So yeah, the two steps that are most important to me: make sure you wash, and make sure that you're using a growth factor to help boost that collagen. And in the morning, the most important step is going to be sunscreen, 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 sunscreen. And if I was going to be 2 steps, I would say vitamin C and sunscreen.
All right, I'm taking mental notes here, because that sounds like a great routine. And you know, I guess maybe I could eliminate some of my products if it saves some money.
And time.
And time. Yeah. Dark spots. So you kind of touched on it a little bit, right? But
yes.
What causes, because what is there a difference between sunspots, age spots, and liver spot? Well, I know the liver spots are red. They're like blood blisters or something, right?
So those are cherry angiomas, I think is what you're referring to. As we age, we get these little, almost, they look like red moles. Those are more cherry angiomas, and those things are treated with lasers in our office. Brown, I would say the biggest differential, you know, in an age spot and a brown spot are pretty much the same thing. What's different is melasma. Melasma is going to be treated differently than your brown spots typically. Now, your at-home products are going to be very similar, but the in-home procedures, that's where you're going to see a difference in what we choose to do in the office. But your sunspots and age spots are pretty much the same thing. And those are treated with hydroquinone products, vitamin C products, and retin-A, those types of things that are things that can be done at home. In the office, we would do what we call BBL. The old school, we call it IPL or photofacial. And the newest, you know, and greatest and latest on the market is BBL, which we have, and it's very, very effective. And we can treat the brown and the red, and there's many different things that we can treat with that in our practice as well. But if you have melasma, we're not going to do that laser on you, because it can actually make the melasma worse. So in those situations, we would use a different type of procedure to treat melasma versus a brown spot or an age spot per se.
Well, and I just noticed, I have never even been concerned about melasma, but I just noticed both sides of my neck, I have like these patches. You're familiar with that. What causes that?
The sun. A lot of times people wear a hat, like a baseball hat. And if you think about it, only this part of your face is being protected, but you're still getting lots of exposure from the sides and the back. So, you know, I am the nerdy girl that tends to wear, you know, my fishing hat or a bigger hat at my son's games and things like that, just because this, you know, you're getting exposure from on the sides of your neck. So we see that a lot. It's easy to treat, but people just need to be conscientious that a baseball cap is really not going to do anything for the sides of the face and the neck. So it's important to wear, you know, a hat with that's a little bit bigger. It has a little bit more larger brim.
Gotcha. Okay. Sensitive skin.
Yes.
So is there anything that can be done to, like, not even, I guess permanently is a big word, but to fix sensitive skin, or if once you have it, you're going to always have it?
Well, I think, you know, if you have, this girl has sensitive skin. I think you have to learn how to manage it. And I think when we're putting patients on protocols for sensitive skin, that we use, you know, the products that we have carefully curated in our office. We choose things that don't have fragrance, don't have color, don't have parabens, things of that nature. And you never take a sensitive skin person and put them on a regimen. So we're going to do one thing and we're going to see how they respond. If they have no reaction, we're going to add another thing and see how they respond, and so on and so forth. So we can really see what's going to work for them. So I think learning to manage sensitive skin is important. Also, there's many tests you can do, allergy tests and sensitivity tests, to find out what's causing them to react the way that they're reacting. It can even be hormonal. We know that hormones can cause patients to be more reactive or less reactive. I know that the older I've gotten, the more reactive I've gotten to certain things. So it's important to start with less is best. And let's figure out, you know, what we can use to work for the patient. And so even sensitive patients too, I get this question a lot is, well, I'm sensitive. Can I use Retin-A or retinol? And can I use these things? You absolutely probably can. We just have to titrate you up very, very slowly and make sure that we're not throwing it on you every day all at once. So just, you know, making the small adjustments and trying a product. I think it's hugely important. Most of the products that we have in our office, we have samples of. So if a patient says, I'm super sensitive, I really don't let them walk out with a bag full of products, because I want them to have samples and go home and try it to see if they have any sort of reaction.
Mm-hmm. You said something else that I'm going to get to all my questions, but they pop in my head, and then I get engrossed in your next statement, and I'm like, oh, now what was I going to ask her? Oh yeah. So when people have sensitive skin and they've tried all these products in the past, and they've said, oh, I can't use that. They actually possibly could. It just needs to be gradually introduced.
You know, it depends on what product it was, because products are vastly different, right? So if a patient tells me they're sensitive, but they're using a product that comes from Macy's or Dillard's, let's say, I immediately know that it's probably the fragrance, the parabens, even in makeup, sometimes talc, things of like that, that have huge inflammatory properties to them. But that's probably why they were reacting to something. And so until we get to a cosmeceutical grade product that really has none of the fluff in it, and I always tell patients, our products are not going to smell like they came from, you know, a fancy store in a pretty bottle, because that's not what these products do. These products work, but they're, you know, sometimes it's something as simple as a fragrant in a product, or a color in a product, or a paraben in a product. So it's important to know what actually specifically they've tried in the past. And then we can look at the ingredient list and really kind of know what are the hot spots, things that might be in that specific product that people are using that could be causing that sensitivity.
So if someone's at home right now and they've just battled with it, so they just quit using everything, are there products that you would recommend, because they can't get in to see you right now? You know, if they were to go to I guess you're going to have to go to a drugstore because everybody else is closed right now. Are there products that you would recommend for them that would be safe if they're wanting to try to start getting on skincare between now and the time they can get in to see someone like you?
Absolutely. So Cetaphil is something that we used in our practice after post-ablative procedures. Cetaphil is very gentle on the skin, either from the cleanser to the moisturizer. That's something you can buy, at Walgreens or CVS or grocery store. There's also a product by a company called La Roche-Posay, and they're dispensed in Walgreens, I think for sure. I'm not sure about CVS, or they can be purchased online. La Roche-Posay has an entire line called Tolerian, and Tolerian means intolerant. So it's for patients that have intolerant skin, and those things are going to have minerals and zinc and things that are going to calm the skin down and chill the skin out. So absolutely, there are things that patients can get OTC that can help right now just kind of calm their skin down. I also tell patients that have super sensitive skin, keep a bottle of your moisturizer, your favorite one, in the refrigerator, because it's so refreshing. If you're feeling like you're having a hot flash, or you're getting splotchy, or you feel like, you're being reactive, just to go open the fridge, take a few pumps, put it on your skin. It just calms things down. So just simple things.
Well, and the coolness would also reduce inflammation, right?
Absolutely.
What about those rollers that people purchase, the Jade Rollers or all the different rollers?
So, we use some of those in our practice. We keep them nice and cool. They're very therapeutic. I don't know that they're going to actually do anything for the skin besides calm things down and feel good. But I will tell you that if you have under eye puffiness in the morning, if you keep that one in the freezer and you put a product on that has a little bit of caffeine for under the eyes, and you do the rolling, and there's a way that you can do lymphatic rolling to really get the best benefit to alleviate puffiness. But those are effective, and they can work and just help reducing that under eye puffiness and even the puffiness in the eyelid. So yes, they can work. They're not going to be a miracle thing, but little things like that can make a difference.
Well, and then they all add up to
Absolutely.
Let's see how this one probably is a hot not a sore spot. How do we get rid of blackheads at home?
Oh, exfoliate, right? So as long as you're turning over those skin cells, what a blackhead is oxidized sebum that's caught in a pore. And the bigger the pore is, the deeper the hole, right? So if we can just exfoliate the skin and use either chemical or physical exfoliations to get that those pores to turn over and those cells to turn over, then the pores are smaller. And so it's oxidized sebum, and a lot of times that can even be caused by products that you're using that are not non-comedogenic. And so sometimes patients think that they're doing themselves this huge favor because they watch this infomercial and they buy this $300 cream. Well, if it's not non-comedogenic, they end up either getting blackheads or what we call Melia, those little white bumps that are trapped underneath the skin. And so we can get rid of those in our practice, but they're something that really you can get rid of at your home, or it's for something that you're using at your home that can actually cause those. So just, keeping the skin clean and the skin cells turned over will help alleviate a lot of those problems.
So again, growth serum and exfoliating.
Exfoliation and cleansing the skin for blackheads absolutely is going to help.
Okay. How do I know when my products are expired or have gone bad?
So our products have expiration dates on them. So that's crucial. If you're using a product that doesn't have an expiration date, then it's probably not going to do a whole bunch of things for your skin, because that means that the product is considered, not stable. But anything that's stabilized, like let's say L-ascorbic acid or retinol product or growth factor product or vitamin C, those all have expiration dates on the bottle or on the box. So just be, aware of that. And then, there is a misconception that vitamin C's, once they turn orange, then that means they've oxidized and things of that nature. But a lot of times the vitamin C products are already kind of that yellowy orange color right off the shelf. And so I would say just, make sure you keep your products in a cool, dark place where they're not being exposed to a bunch of sunlight. And make sure that the place doesn't have a lot of humidity in it. But, you just look for those expiration dates, and for smells, if they've changed or they smell old, they probably are. But just, most of the products do have an expiration date on them.
Okay. Yeah, I've always felt like that smell factor is a true indicator. What about oily skin? Super, not just oily, but I mean like almost a medical condition oily. How can we manage that?
So there's different things at home. Do you mean how to
Yes,
manage
yes.
how to manage
Well,
it at home?
at home
So
and in office.
So in our practice, we have some wipes that are it's a prescription, and those wipes are really good at keeping what we call kind of just the dirty. If you have lots of acne here or in the T zone, the clindamycin wipes are super helpful for topically kind of helping manage that type of acne. Salicylic based products are things that you can find usually on maybe sometimes online. I'm not sure how strong they'll be, but anything that has like salicylic acid will help with oiliness. Glycolic acids tend to help with oiliness as well. Retinol products help with oiliness. So, and just using a good anything that has those multifaceted acids. Sometimes they have more than one in them. Those will help at home. Kind of control that oil.
And should we avoid a chemical exfoliator if we have oily skin? Or not chemical, a physical exfoliator? Should we only use, there's a myth that aggravates the oil production.
Well, if you have inflammatory acne, active acne, then I would say be conscious of that, because you don't want to cause an abrasion to that active acne and cause it to scab. So I think that you have to be, if you have an active breakout, which is a little bit different than being just oily, then I think you're fine to use something that has a physical exfoliator. But if you have an active breakout, you want to be careful not to scrub and rub and cause those papules and pustules to kind of bust and scab, because it just can cause you to have scarring per se.
And then they have to come in to you to have it fixed.
And scars are not fun to treat, so I would just say it depends on if they're having an active breakout or if they're just truly oily. Then absolutely, there's either way, there's things we can do. But clindamycin wipes are hugely helpful for those active oily, super oily patients.
Okay. And then the big question, I'm going to go back to that. I saved the most popular question. You've covered it when we talked about wrinkles, but then there's more to aging skin than just wrinkles. There's the loss of elasticity, the collagen production slows down, and all those things. The big question is, let me look. How can I prevent aging skin?
So preventing aging skin is kind of dual faceted. So you have wrinkles, you have elastosis, you have loss of volume, you have loss of fat, you have loss of muscle. And that's why, we start as an upside down triangle and we kind of end up being this triangle that's right side up, where we're wider down here and we're thinner up here. So the things that we can do to help prevent the elastosis and things like that is to help feed the tissue, and anything we can do for collagen induction therapy to thicken up that dermis, cause collagen to grow, help tighten up the skin integrity. Those types of things are going to help reduce the aging process. So, and that's kind of a tricky question, because you can't make the skin grow fat if you've lost fat from aging, and sometimes you can't force enough of it for it to, we have to use sometimes fillers. Let's say in this area, people come in, if they're really sunken, we have to use a certain filler there to kind of fill that back up. In the jawline, sometimes we can use fillers, but sometimes we have to use other laser treatments and things to cause that tissue to tighten back up. So, aging skin is not just wrinkles, it's elasticity, it's fat loss, it's muscle loss, it's a combination of all of those things. So obviously we can't treat everything just by a product sitting on our shelf, because not everything that we do has to be done externally, but there are those types of things that we have to do internally as well to help the body stimulate collagen. And some of the fillers that we use actually can help stimulate collagen that we do in our practice. So it's important to, have a good person that you see in an office setting that can do more of those types of things, as well as use those stem cells at home to help, and growth factors at home to help, kind of slow down that aging process.
You're incredible.
Thank you. Gosh, there's so much to talk about.
We have covered, Cellulite. Tell us
Yes.
about that's wait, before we do that, I want to invite anyone who's viewing live. You know, this will still be out there for replay in the group, but I want to tell them if we haven't covered a question that that they're interested in. We're almost out of time, but to go ahead and send it our way, and we'll see if we can get it answered. But I think we've probably covered everything except for cellulite. So
that is $1 million question as well. So there's many different schools of thought. There are schools of thought that it can't be helped besides having kind of some sort of surgery. Or there's other people that say, there are things that we can do to help the appearance of it. And so in our practice, we do kind of multifaceted things to help the appearance of it. And we've been pretty successful with our little cocktail of things that we do. We have a cream that it's called Mesoderm, and we get it from a pharmacy, and it's absolutely fantastic. And literally people buy 8 bottles at a time, but it's deoxycholic acid, which is the same product that's in Kybella, which Kybella is something that we inject for the submentum fat here. That's super effective. So for cellulite, sometimes we do multifaceted things. We do a Mesoderm cream at home, and then we will come in and we can actually treat the pockets of fat around where the dimpling is. And then into the dimples, we actually add some biostimulating fillers at a hyperdilution ratio that really helps the appearance look smoother. And then we also have patients do things at home like their fascia blaster. I know sometimes people, oh my God, is that for real? It is effective. If we do these things in combination, we can really help the appearance look a lot better and lay a lot smoother. So, I would say you absolutely can improve it. I'm not sure we can get rid of 100%, but we have patients that are super satisfied with kind of our 3-prong approach to smoothing out the cellulite in the legs, tightening up that skin, alleviating those fat pockets, and causing collagen to grow and just cause an even appearance of that skin.
Yeah, and is cellulite genetic, or is it diet, or is it lack of exercise, or
it's typically it can be a combination of everything, but I always say it's genetics. First and foremost, mom or dad has it, or grandma has it. You probably are built not much different than your mom or your dad, right? So that's one prong approach to it. Second is going to be diet, and third is going to be exercise. 80% of the fat that we have in our body is from what we choose to put in our mouths. And so, I'm not the expert on exercise, so I'm going to leave that to the people later in the week that are the experts. But I will say, if we have more hydration and we do exercise more, that does help us have lower percentages of body fat. So overall, if that skin's going to look better. Also, if the skin is tighter, then the cellulite looks less. And so there are skin tightening things we can do in the office that help the appearance of it. So, it is genetic, but it's also kind of lifestyle decisions. Because I will tell you, when I'm 10 or 15 pounds heavier, my cellulite's worse. And when I'm, lose a little bit of weight, my cellulite just looks better because that fat is thinner. So we know that, what causes cellulite is little bands of muscle that kind of pull the tissue down, which causes this rippling effect, right? So the thicker that tissue is, I always say it looks like it looks more tufted, right? If we're thinking about like a sofa or a chair. So I think it's multifaceted, but yes, it is going to be genetic and lifestyle choices as well.
We didn't even touch on water for your skin. I mean, that's one of the big things that we've all been preached to about is water, water, water.
Yes.
Do you have anything to say?
Well, I will say this: if you're hydrated and you're preaching to the choir. I am the worst person for drinking water, but hydration is key because it flushes the body of toxicities, and it's going to make things look better. As far as if you're flushing your body and you're staying hydrated, then your skin's going to show it, right? And just like if it's going to make a huge difference. And also getting plenty of sleep, which I'm being a hypocrite when I say that, but staying hydrated and sleep are crucial to anti-aging overall.
Okay, good. You did cover this earlier. Someone sent in a question about Melia, how you can get rid of it at home. And I know you've already covered it, but would you mind touching on it again?
So Melia, you can probably minimize the ones that you are getting at home by not using products with parabens and exfoliating the skin. But a lot of times we have to have that done in an office setting where we can use certain tools where we can actually, you know, get the skin in a nice position where it's been steamed and softened up, where we can actually use tools to get those milia out of the skin. So I would not recommend like trying to poke them with a needle or do anything like that at your house, because you could cause scarring. But just being, you know, for just being conscientious of what you're choosing to use. So, you know, make sure you're exfoliating and keeping those cells turned over, and then just what you're putting on it after you're exfoliating, make sure things are paraben free and non-comedogenic and those types of things.
Okay. Thank you. And that was Holly, by the way, that asked that. So, okay, well, again, thank you so much for joining us. For those of you who are watching it either live or the replay, I am going to put a questionnaire, or actually just a post. I'll put a separate post requesting y'all to share with us your biggest takeaways about this, because that's going to give all of our presenters, but specifically Melissa, it's going to give her the ability to know what's important to you and her other clients as well. So be sure and do that. Now, also, be sure and share this video. Again, you know, let's spread the word, because this is some great information that, you know, it can help a lot of ladies, help them just feel good about themselves when maybe they weren't feeling so good right now. So do you have, how can people, if they want to reach out to you, because we're going to have some people here locally in the Houston area, and we're going to have people across the country, and I know there's people from around the world as well. How can they reach you with questions or appointments or products?
So Instagram is a great way to reach us. You can follow us on Instagram and send us a message, or Facebook as well. We are very good to get back with patients if you have specific questions. And we also do some educational things, a lot of educational things on our Facebook and Instagram, because we are doing some videos on what their questions are. It's funny that this came up because last week we had done a Facebook Live on our Facebook video saying, what are your questions about skincare? So this today has actually answered a lot of what I was going to have back and make videos on. So I'm really excited about that. But you can reach us on SkinScriptions by Melissa Gibbens on our Instagram page or our Facebook page, and follow us. And maybe just from hanging around, you'll learn some additional information. But if you have a specific question, we are all working remotely. And so everyone's super tuned in to questions that are coming in. If you need to know what product might be right for you and you want to just ask someone, we're happy to chat with you about that. And then you can shop online on our Instagram page on Shopify. So, you know, you can reach out to us in multifaceted ways, or you can call or text our office. It's that simple. So
y'all are actually answering your phones right now?
We are answering our phones and we're returning text messages. So we are staying connected to our clients and letting them know that, you know, we're here every step. We have shipped so many products during this time because patients are just like, oh my gosh, what can I do? Or I'm out of this, or I'm out of this. And, you know, it's funny because sometimes they're like, I don't know if my skincare is working. I've heard so many times now that since they're out of something that they're like, it really was working. So in a way, it's kind of good that they're out of these products, because now they're going, oh my God, my neck is looking different. Oh my God, my eyes are looking different. And so we've been doing a lot of shipping and drop shipping and things like that. So we're all working remotely. I'm here at the office by myself right now, and I miss my girls, but we're here for you. And just use us while we have some time to really be dialed into your needs. And we're happy to do it. And thank you for asking us to be here today.
Thank you so much. I've said it a million times, and I'll probably say it a million more. I'll probably text you here in a minute and say thank you.
You're welcome.
It's been great. And I hope that you have a great afternoon. And yeah, we will be in touch. And
all right. Thanks so much. Have a beautiful day.
You too.
Bye-bye.